I'm Dr. James Choo with Pain Consultants of East Tennessee, and this is...
I'm Dr. Laura Stockdale. I'm a psychologist, and I am with Behavioral Medicine Institute, but I'm here at Pain Consultants. I'm embedded in this practice almost completely. Here.
How long has that been?
7 years.
7 years now.
Mm-hmm.
Yeah, so you and I have worked with each other for 7 years. And you're also colleagues with Dr. Ted Jones and Dr. Robert Deborah.
Mm-hmm.
Yeah, so... But let's hear a little bit about your background. You've been in behavioral medicine, or just how long have you been a psychologist?
Well, I've only been a psychologist for 20 years, and before that, I was a nurse practitioner, clinical nurse specialist with a master's in psychiatric nursing and a bachelor's in nursing. So I've always been really interested in that mind-body connection.
And you worked a lot as a nurse or as a psychologist in the cardiac floors prior to kind of transitioning, is that right?
Right, but I've always worked with medical patients. Normal people, as they say, people in abnormal situations that they never planned for.
So kind of these traumatic, stressful medical events.
Including chronic pain.
Including chronic pain. And that was prior to coming over here, right? Is that right? Yeah.
I've always worked a little bit in pain management.
Wow, that's great. So, and then, but for the past 7 years, it's been
I've been with
exclusive.
You guys exclusively.
Yeah, and in Dr. Stockdale's insights for us clinicians have been really important to help us figure out what's going on with the minds of some of our patients. And we find it's important. From your perspective, how do you think it's important for just the patient themselves?
Okay, well, I explain this to every patient when they come in. The first thing I tell them is, we don't think you're crazy. That's not why the doctors have sent them here to see me. It's just people get better care when you as a staff and we as a staff have a better sense of who they are as a person, so that it's a good assessment just what's going on in their life. What are their stressors? You and I know that stress makes pain worse. They also are always afraid that we're saying it's all in their head, which we know there's not. You do a great workup on a diagnostic criteria. What is structural problems, muscular problems? So I try to reinforce it. No, it's not that we think it's all in your head. But the assessment that I do and the other two psychologists have several components. The biggest one is, what are their coping skills now? What is their stress level? What is causing them stress? Have they noticed their pain gets worse around Christmas time or being with a family? So that the whole team can make up a more comprehensive treatment plan. I mean, if somebody's had a death in their family, we might need to do some grief work. We look at coping skills. What coping skills are they using now? What coping skills do they need? Also, the events of the pain event. My assessment and my approach towards a workman comp patient who's at 35 and goes to work fine and then has a traumatic amputation, their picture is going to be different than somebody who is got chronic pain from osteoporosis or diabetic neuropathy.
Meaning, those are diseases that are chronic, long-term, maybe part of aging, versus someone who's had a traumatic experience at work that has been life-altering. You're talking maybe someone who's 80 years old, who's lived a long life having diabetes, versus someone just starting their lives and then being a provider at 35, boom, they've got a traumatic issue that changes the course of their life in unexpected ways.
Being a provider, being an independent person, being a mother. So I look at those feelings, I look at those emotions, and that helps you guys. What does this patient value in their life that they've had to give up? We asked, what have you not been able to do that now because of pain that you used to be able to do, and how important is that?